Hello, my name is Lillian Champion, and today I will be doing a final exam presentation on office-based surgery clinics for my class on Intro to Healthcare Systems. An office-based surgery clinic is a facility that is set up much like a basic primary care doctor's office, but has the necessary skilled equipment and staff to do minor surgical procedures in-house. For my personal example of this healthcare facility, I will be using a local OBGYN clinic as a reference for most of this information. There are 4 important factors that should always be considered when discussing a type of healthcare facility. Number 1, function of the facility. Number 2, economical impact. Number 3, politics. And lastly, the administration. Each one we will be discussing individually. Moving on to function, functional means a practical use for function in design. The first thing when I think of functional is the healthcare facility iron triangle. At each point of the triangle is a different word: quality, cost, and access. The goal is to try to equally balance all of them to provide the best possible healthcare to the community in which this facility is in. They all 3 coincide with each other. For example, if the cost decreases, the quality or access must decrease. Or if the quality improves, the cost will increase. You cannot have one without the other if you want to have a good healthcare facility. There are a few pros and cons to this facility. The pros: 1-day surgery areas for different feminine procedures, yearly physical exam rooms, and birthing suites. The cons are the fact that there are no C-sections able to be performed at this facility, and there is no NICU, or neonatal intensive care unit. Next, we will be discussing the economical impact. What are economics? Well, economics is a condition of a region or a group that regards to material prosperity. In other words, this facility vastly helps the economy, in my opinion. Here is a few examples. It assists with payment by helping lower income or non-insured families with a payment plan that's based on their monthly income. If the entire bill is over 60% of their yearly income, then the services are free. This clinic also uses the state health fairs to help people educate about health, thus increasing health literacy. This facility also offers free abortions for expectant mothers up to 12 weeks, preventing the risk of back alley abortions. Back alley abortions are abortions that are done at home or in a setting that is dangerous to the health of the mother. As we move on to politics, politics is described as an activity associated with the governance of an area. The ACA, or Affordable Care Act, also known as Obamacare, is a big discussion among both politics and the healthcare system because it affects both. It was passed in March 2010 by President Obama. Its goal is to lower healthcare costs for households below the federal poverty level. Based on the facility I'm using, it has a big stigma. The ACA's stigma is known as a mark of disgrace or a bad influence. It can be good for healthcare, but it has caused so many problems with this facility, so they no longer accept patients with it. Another big thing that this facility does is offers payments assistance for active United States military personnel and or their spouses. They provide discounts for invasive procedures and free health care for non-invasive procedures. So, since we are the South and we do love our troops, it makes the Southerners happy. The 4th and final factor we will talk about is administration. Administration is the process of running a business or an organization. This OBGYN clinic that I researched for this project uses the HCAP system to help improve the care that they provide. It is also accredited by the Joint Commission. The Joint Commission, also known as JCO, is an accreditation organization that allows the facility to use and accept Medicaid and Medicare. One thing that I really like about this facility's administration is the Board of Directors. Every 2 weeks, the Board of Directors meets to discuss the HCAP scores. If they are low, they discuss specific initiatives and projects to help rectify or eliminate a situation. Their version of improvement strategies. Lastly, I want to talk about giving yourself some SMART goals. When you set goals for yourself, you should think SMART. Specific, measurable, achievable, realistic, and time-bound. SMART. Today, I'm going to give you a few examples with my 3 SMART goals for the future. Number 1, I will complete my healthcare administration degree from the University of Arkansas, and only 2 years because of the 6-week online semester in their eVersity program. Number 2, after receiving my degree in healthcare administration, I plan to move to Nashville, Tennessee and become an administrator for Tennessee State Veterans Homes in August of 2020. Number 3, while working as a healthcare administrator for the Tennessee Department of Veterans Affairs, I am going to attend Vanderbilt University's School of Nursing in Nashville, Tennessee, and receive my online master's degree in nursing to become an instructor or nurse preceptor at Vanderbilt Hospital when I graduate in May of 2022. If you would like to follow along with the video, please use the YouTube link below. Also, remember to set goals for yourself and study hard. That's what makes a good healthcare administrator. Thank you.